Good morning. I'm very happy to be here. Ladies and gentlemen, it is a great pleasure for me to attend the first Uppsala Health Summit conference with the important theme, Healthcare for Healthy Aging. Aging is not something we may choose. It is constantly ongoing, and I experience that. And some of us will have the fortune to age healthy with normal aging functional deficits, but without chronic diseases. And some of us will suffer from different diseases, some chronic, sometimes a couple or more, in combination with the normal aging processes. Some of us will have a large family around us. Some of us will be alone. Some of us will be family carers taking care of a family member with needs due to disease. The knowledge of normal aging is named gerontology and is multi-interdisciplinary. Gerontology helps us to understand the aging process from different perspectives. Aging may be divided in social, psychological, and biological aging, each with the impact of the person's life and health situation. Aging can not only be seen like the numbers of years we have lived. The knowledge of normal aging and the research about different aspects that contribute to health in the aging process is important. And with the demographic picture and challenge we all share, I believe gerontology also could be spread broader than it is today into both multi- and interdisciplinary education programs. Geriatric medicine is outgoing from gerontology and deals with the elderly people affected by one or several diseases in combination with need of caring support to manage the daily life at home or in a sheltered living. With the demographic picture, this, especially for care professionals, also seems like a subject for expansion. I began engaged in the area of dementia when my own mother, unfortunately, was affected more than 20 years ago. And I very soon understood the importance of knowledge and the need of education corresponding to the practical work for quality in care. I started the Silviahemmet 19 years ago with the intention to educate assistant nurses in dementia care for highest quality of life for both the person affected and the family. At that day, the challenge of the aging society was not in focus, nor the figures of one of the most frequent and also costly age-related diseases panoramas, dementia. Today, the education of assistant nurses is a university education in cooperation with Silviahemmet University in Stockholm. The education is web-based, and the assistant nurses study for 2 years while working part-time. Next week, I'm happy to provide 82 assistant nurses with their Silvia home brooch and the title Silvia Sister. After this event, there will be nearly 500 assistant nurses spread around our country, trained to be specialists in dementia care. The equivalent type of education is also available for nurses, and this year more than 150 Silvia nurses have passed examination. Next year, for the first time, I will provide 9 medical doctors with their decorations after they have managed a master degree in dementia care from the Silviahemmet Corporation with the Karolinska Institute. I'm now hopeful that a similar education for occupational and physiotherapists will start next year. When discussing healthy aging, my perspective is naturally around the person with dementia and their families. One issue is what may be done to prevent persons from getting this devastating disease, affecting their whole family for many, many years, when yet there is no cure. Swedish they're difficult words. The epidemiological data shows that the lifestyle is important and may postpone the dementia disease. Food that is good for the heart is also good for the brain. Social and physical activities, control of the blood pressure, and cholesterol are positive factors. When a person gets the diagnosis dementia, there is almost always a second patient, said Professor Henry Brotherdy. The term dementia is the disease of the family is well known. The family carers are many, and without them, the society would not be able to finance all the care that is needed. Support of the family carer is an important issue, and the individual family needs must be assessed. This may be done by different actions. In 2008, the National Competence Center, the Swedish Dementia Center, was started by a government initiative to collect structure and spread knowledge about dementia. The target groups are persons with dementia and their families, as well as healthcare workers and stakeholders. Last year, they participated in a project together with our National Museum, Silviahemmet Foundation, and Dementia Association. This project, called in Swedish Möten med minnen, inspired by MoMA's, the Modern Museum of Arts in New York, making art accessible to people with dementia, and Meet Me, aims at arranging art views for persons with dementia and their families. The museum guides are trained for 2 hours about dementia by Silvia's sister. And today, 1.5 years later, more than 75 museums all over Sweden are having art views specially arranged for persons with dementia and their families. The museums are now meeting points in the society, outside the healthcare sector, providing the family affected by dementia with new memories and stimulations of the senses. This initiative is hopefully a start of more cooperation toward a dementia-friendly society. This is one example of how different stakeholders can meet and together create the new possibilities in the society for people living with chronic disease. Healthy aging is a challenge for all of us, and healthcare for a healthy aging is a major issue as it affects so many other structures of the society. The Uppsala Health Summit is an initiative, a meeting place, to discuss this challenge multidisciplinary between different stakeholders. I'm happy to attend this initiative, and I hope you will have success with these 2 days of interesting discussions and that new cooperation will be created. I wish you all luck, and thank you very much.
Good morning. Is it okay if I ask a couple of questions? May I? Oh, thank you. I would just like to hear, please, I just learned that today, this very day, a number of German doctors are visiting the Silviahemmet in order to learn, because they really want to learn from the way you educate, and they want to create dementia-friendly hospitals in Germany. So this is actually spreading around the world. How does that make you feel to know that they come already from abroad to learn about what's happening?
I'm very happy and very proud also. And you're talking about Malteserorden.
Yes.
And they have been visiting us for some years now, and we have a larger cooperation, and they're very keen about our way to work and how we meet the patient and our philosophy. And so they already started 4 homes in Germany, yes, and in Munich and in Bottrop and close to Hamburg and in Cologne. So yes, so I'm
spreading.
Yeah,
yes.
so I'm very happy about that, and so this was very interesting because not only let's say the doctors came, but they had the chief doctors, and they had from their board members coming, and they were all very interested. And I think that's a sign that you really should get education all the way. Not only the doctors, but also everybody who's meeting the patients, which I think is very, very important. And I'm happy, of course, that now those 8 doctors, they're very important doctors in Sweden, so in Germany.
Influential,
so, yeah,
yes.
They're very influential. So, of course, I'm very happy about it.
You should be. And I can't help associating to the, in this room, very well-known Israeli professor Aaron Antonovsky, who created the idea, the concept of the sense of coherence, KASAM in Swedish, where when you meet very difficult challenges in life, as you did with your mother, if you can invest energy and that will actually create meaning in your life, that you can see how this has really helped so many people. And we were talking about that yesterday, how the psychological aspect is not always addressed here. We focus a lot on the physical problems, but you're talking a lot about the meaning, about the caring, about the social aspects. Was that new when you began to explore it that way?
Well, when it came, of course, to my mother and dementia, this, of course, was very new for me, because my father, he was always at her side, so he took over in a way, so we children, we didn't really know it. It was only when he died that we saw that something had happened. And I think what everybody should know and think about is the struggle for the family members. I mean, it's a very strange situation, because in your heart you are very sad, you are upset, you don't understand the situation, you don't know how to handle it. But to your family member, in my case my mother, I should show a face of happiness. So not to influence her, not to upset her or so. So I think that was a very strange situation and very, very difficult to handle. To smile outside, but in your heart you're bleeding. And I must say, the family members who are taking care of their parents, it's a very heavy burden. So they really should need all kind of support they could get.
And you didn't get that at the time because it wasn't a well-known diagnosis?
No, not at all.
Was needed?
No, to be old is just a normal thing, and if you forget something, it's also normal. And nobody really understood that there is something else, that there is a illness, and unfortunately an illness which is a terminal one, which of course it's heavy to take.
So finally, you mentioned the lifestyle changes that can help preventing. If you could just wish and desire what would happen. All these people are very carefully picked because they really are influential in their arenas. What do you wish we should do on the national level to begin with to also implement all the research that we do have today about what can help?
What shall I say when I have all the experts in front of me?
You can wish.
Well, what I feel is that many people in Sweden and also abroad don't understand, don't know what it's all about, don't see the patient, don't have the patient, the patience, or the
Patients
patient, themselves. And I think there's a lot to do. And so if I can help in that area, William, love to do that and to talk more about that. And I think the knowledge is, you see, when my mother became ill, we had a wonderful help. And this was a lady, a woman who had been working 15 years with elderly care. So she was excellent. But at the same time, she didn't know anything about dementia. Of course not, for so many
different.
years ago. Yeah. So she didn't understand why suddenly my mother reacted in a way that, I mean, she did what she could, the best she could do, but my mother reacted differently, and in her eyes wrongly, of course, and so. And then I started to wonder, and then I started to seek expertise, and so I started to ask, what is it, and so on. And then Professor Breakfast just told me, education. Education, and that's why we started our home. Well, it's called home, and it's called Silvia Home, which sometimes I get a bit shy about it, but
you deserve it so well.
I'm getting used to it. But so it's a school, really. Mm-hmm. It's a school, and by data, by internet, yeah.
Mm-hmm.
Yes, and so we developed it with Silviahemmet,
yes,
in a university, for the nurses and assistant nurses. So they can work, but they can participate in this education. It takes 2 years and 60 points at the university, so it's quite tough. And the nurses do the same, short, of course, because they had already their very excellent education. So that's only 30 points. And but the doctors, they have to take it 2 years and 60 points as well.
You look very pleased over
I'm
that.
very pleased. I'm not mean. I'm not mean, but I'm very happy because...
you really understand the level, that it's
yes.
an extremely demanding know-how.
And I think it's wonderful that the doctors also want to
yes.
become expert in dementia. Of course, they're experts in everything, but dementia was not the question at that time.
No.
And so the interest is growing, and I'm happy that there's a team now. You have assistant nurses, and doctors. So I'm very happy that doctors are interested now in it.
And we are very happy that you're doing this work. Thank you so much for that. Thank you indeed.